All right, hello everyone, and thank you for joining us with the National Telehealth Webinar Series. We're thrilled to have you today, and we're thrilled to have our student consultants from the Boston University School of Public Health to present our session, Engaging Providers with Telehealth Technology, Training Modules and Communication Strategies. Next slide, please. For any of you who may be joining us for the first time, the Telehealth Resource Centers are federally funded through the Office for the Advancement of Telehealth, which is part of the Federal Office for Rural Health Policy. We have 12 regional resource centers, and together we cover all 50 states. And then we also have 2 national centers. One is the Center for Connected Health Policy based in California, and they track all existing and pending legislation and regulation related to telehealth. And then we also have the Telehealth Technology Assessment Center based in Alaska. And they're sort of like a Consumer Reports for telehealth technology, and provide a lot of great resources around selecting and assessing technology. If you'd like to find your local telehealth resource center, you can visit our national website at telehealthresourcecenters.org. Next slide. We do host a variety of different events throughout the year. Coming up, we have several exciting conferences. The Northeast Regional Telehealth Conference is taking place on May 23 and 24. The 2017 California Telehealth Summit is taking place on June 5 through 7. The Indiana Rural Health Conference with a telehealth track sponsored by the Upper Midwest Telehealth Resource Center is on June 13 and 14. And then the Telemedicine and Telehealth Service Provider Showcase is in Phoenix, Arizona on October 2 through 3 this year. And the websites for those events you can see on the slide, and we will post these slides on our website. Next slide, please. So just a few notes as we get started on the webinar today. You will notice that you've been muted, so no worries. We have reserved time at the end of the session for Q&A. We do ask that you ask your questions through the Q&A box down at the bottom of your screen. Please feel free to answer or ask those questions at any time throughout the webinar. If it's something that I can answer while the students are presenting, I'll go ahead and enter in the text box, or otherwise we will reserve the questions for the end of the webinar. We do have a survey at the end of the webinar, and we'll post a link for that survey. We certainly appreciate your feedback as we continue to improve our national webinar series. The webinar is being recorded, and we will post a recording on our National Telehealth Resource Center YouTube page. And you'll get a link for that if you subscribe to our monthly updates for this webinar series through the Upper Midwest Telehealth Resource Center. You get a link for that and a link for our upcoming webinar that we'll talk about at the end of the series. Next slide. So, without further ado, I'm thrilled to introduce you to our student consultants from the Boston University School of Public Health to talk about engaging providers with telehealth technology. And I will let them take it away.
Thank you. Thank you all for joining us today to discuss telehealth and how we can increase provider use of technologies. The topic of our webinar is Engaging Providers with Telehealth Technology, Training Modules, and Communication Strategies. We will now begin by introducing ourselves. As student consultants at Boston University School of Public Health and knowledgeable experts on creating communication-based interventions, we are excited to bring this presentation to you today in collaboration with the Northeast Telehealth Resource Center located in Maine. My name is Kalpita Patel, and I'm an MPH candidate focusing in health communication and promotion, as well as program management.
Hi, my name is Alaa. I'm a dentist and a doctoral candidate in dental public health.
Hi, my name is Meaghan Wostbrock. I'm also an MPH candidate, and I'm focused on social and behavioral sciences.
Hi, I'm Deana, and I'm an MPH candidate focusing on global health.
Hi, my name is Cerda. I'm a journalist. I'm an MPH candidate, and my concentration is in health communication and promotion.
The purpose of this webinar is to present a proposed solution to a problem that NATREC, the Northeast Telehealth Resource Center, has presented us with, and to pitch it to you all as our potential invested stakeholders. As a part of our intervention and communications plan, we are excited to share the pieces we developed over this past semester. Those pieces include a background of the problem, literature results, a proposed intervention, and an implementation technique. Our client, the Northeast Telehealth Resource Center, also known as NATREC, on behalf of the National Consortium of Telehealth Resource Centers, came to us with a problem statement. This problem statement can be summarized in their health outcome of interest, which is creating patient use of telehealth services with individuals in rural areas. The Northeast Telehealth Resource Center is also interested in interventions that can be implemented in healthcare such as hospitals, community health centers, and others. In the next slide, we will go deeper into why patients from rural areas are of interest, but first we want to discuss the project goals outlined in the slide. The project goals we focused on were increasing physician awareness, interest, and willingness to participate in telehealth programs, primarily live video conferencing. Focusing on increasing access to healthcare in rural and other underserved communities is also of interest to us. So, a part of our process with planning an intervention was starting with the target of the health outcome and conducting a needs assessment. This target group was patients from rural areas for us, and the reason for that is because healthcare access in rural areas is a little disproportionately accessible compared to socioeconomic areas of more affluent neighborhoods. So chronic health conditions are more prevalent among rural individuals because of the socioeconomic challenges that disproportionately affect them. These socioeconomic challenges can be seen in their transportation difficulties, limited healthcare supply, the density of health providers in those areas, and the lack of quality health care due to their geographic isolation. So with that, I am going to move on to our plans to address the project goals. So in order to inform best practices, we developed a plan to address the project goals. We had to conduct a literature review, come up with an intervention plan that best suited our target population, and develop a communication strategy geared towards our intervention target group. Deana will now delve a little deeper into the literature review.
Thanks, Kalpita. Before I dive into our literature review results, I want to bring your attention to the corner of the slide where you'll notice an icon depicting a light bulb with some text beside it. You will see this icon periodically throughout our presentation. This will notify you that there is a tip. We have developed these pearls of information from our experiences both inside and outside of the classroom, and hope you will find them useful when developing your own interventions. As an aside, we will not be discussing these tips, so be sure to keep an eye out for them. So back to our literature review results. After completing our needs assessment, our team began a literature review on the access to medicine and telemedicine in patients living in rural regions. The majority of the literature review came from a review of any TRC's website resources and search engines such as Google Scholar, PubMed, and Web of Science. We tackled the literature review foremost by using the social ecological model as a framework. For those of you who are not familiar with this model, it is a theory-based framework that helps us understand the multifaceted and interactive effects of the personal and environmental factors that determine health behaviors of individuals. By using this model, we can identify the most effective behavioral and organizational points for a health intervention. You will notice that the SEM is composed of 5 levels of influence, which include individual, interpersonal, institutional, community, and social and political. Our results show that the most efficacious interventions occurred at the interpersonal level. This led us to using this level in developing our proposed intervention. Our literature review also provided us with useful information in terms of adopting telehealth technology. Successful interventions found that providers' positive perception of telemedicine was crucial for the successful implementation of telehealth technology in medical consultation. Interventions also aimed at increasing providers' positive acceptance of new technology by addressing any barriers that stop them from adopting telemedicine. Some of these barriers included efficacy of telemedicine, apprehension of the new technology, and the time to learn the new technology. Interventions at the interpersonal level also address training for providers that help facilitate proper use of telemedicine technology and promote strategies for patient-centered communication. And
Can I interrupt you for just a second?
Yes.
We got a little feedback that the audio is a little hard to hear.
Oh, okay.
So I wonder if you may need to sit a little closer to the microphone, or we could switch to the other microphone if needed.
Yeah.
Okay, I'll talk a little louder as well. So with that, Meaghan will discuss our proposed intervention.
Hi everyone. So our proposed intervention is called TeleT. We chose this name because it stands for Telehealth Trainings. It's short and catchy, but it also includes the element of telehealth. As Deana mentioned, we found in our needs assessment that chronic health conditions were more prevalent among individuals living in rural areas. These adult patients living in underserved rural areas of Massachusetts became the target population for our intervention. The overall health and quality of life goal that we wanted to achieve for this population was to improve their overall health outcomes. In order to do so, we first had to improve their access to care. And we decided to do this by increasing both provider and patient use of telehealth services. Now, in order to improve this larger goal, we had to first take it back a few steps and think about what it is that providers needed to know, understand, and believe before we can get to the next steps of increasing their telehealth use. As you read through these, you'll see that the goals are fairly basic and really at a preliminary level of telehealth knowledge. Thinking at this level helped us develop topic areas for our intervention that we could present in a short amount of time to pique provider interest without also overwhelming them with information. The model we developed to present this information was a combination of both online and in-person training sessions. The online sessions that we're proposing consist of a set of modules that we suggest be housed on a new section of a web page. Each module has one theme, but several 1 to 5 minute capsules. These capsules may be videos, PowerPoint or Prezi presentations, or quizzes to test knowledge. Now, as I mentioned, these modules are really at that basic level of introductory information, so it was important that we strategically partnered them with these in-person trainings. Each of the in-person training sessions will be about 30 minutes in length, and we're proposing that they be tailored to the specific needs of the organization or hospital. We propose that these online modules be housed on both a new section of a web page and an online and a mobile application. The mobile app is to put the technology into the hands of the physician. This way they can access it anywhere and at any time. We really wanted to emphasize making it just the most convenient for physicians. So we'll go into a little more detail on the website and the app in just a bit, but first I wanted to talk to you a little bit more about our proposed modules. Our online modules, as I mentioned, were specifically designed with physicians in mind. The introductory video sets up the training, and the 4 training modules cover main points of telehealth use, access, reimbursement, and patient engagement. Now on this screen you see a little more detail about each of the modules and their corresponding capsules. We're going to go into more detail on each of these, so no need to soak this whole chart in just yet, but we wanted to give you this overview and specifically emphasize that we designed these without any intended route of learning. So this allows physicians to view them in any order and at any time, again, really emphasizing that convenience. So in addition to the content of these modules, we're suggesting that each video be linked back to already existing resources. So NetRec has a ton of resources on their webpage right now, and our suggestion would be to tie it back to some of those. We'll have a demonstration of our proposed website in just a few minutes, but first Maria would like to describe the content of these modules a little further.
Thank you, Meaghan. So for the introductory video, the project manager will show the telehealth technology and introduce the outline of the training model.
Welcome to the TeleT online training modules. TeleT will help you learn how to navigate, use, and integrate telehealth into your practice. In this training, we will cover 4 modules that include: what is telehealth and why should you be using it? How, when, and where to access telehealth services, when and how to get your patients on board, and last but not least, money matters, getting reimbursed. The modules can be completed in any order and at the time that is most convenient for you. For additional information regarding telehealth services or to inquire about in-person trainings, please visit www.netrc.org.
That was an example of an introductory video. After the introductory video, 4 models will be displayed. The objectives of each of these models tie back to the main objective of increasing providers' use of telehealth. The first model, what is telehealth and why you should use it, will explain in a simple and direct way what are the available telehealth services, including different types of telehealth. It will also explain why physicians should use it by presenting examples of the benefit of using telehealth consultation, such as increased patient engagement, increased accessibility, cost saving, and improving the quality of care. These models will include short videos with positive testimonials of other doctors who already are using telemedicine. With the second model, physicians will be able to explain how, when, and where to access telehealth services. By teaching them how to access telehealth services, they will be better equipped to download new technology and learn how to use it in the proper setting with their patients. Through the when and where, physicians will be better equipped to utilize it in real-life scenario with their patients and understand when it is best to use video conferencing. For example, one of the videos will address bedside manners that are very important to gaining patient trust. Because the consultation is remotely and patients cannot see what is going on, it is very important that the physician explain the steps that he is going to do. The next model, when and how to get your patients on board, will address patient adoption of telehealth services. The videos included in this model will help physicians determine which patient can use telehealth, as well as identify patient resources for telehealth use. For example, through this model, physicians will learn how to address the most common patient question regarding telehealth and the most appropriate way to talk to them about adopting this technology. The last model, Money Matters, Getting Reimbursed, will address the financial benefits and current obstacles of telehealth use. The videos will also address current policies and necessary advocacy solutions that will improve the reimbursement process for telemedicine and the ability for physicians to practice across the state lines. For example, the videos will help physicians understand the financial and time benefits of telehealth use, and they will also see how telehealth can help save their patients time and money. Now I'm going to leave you with Alaa, that is going to introduce the wireframe of the website.
Thanks, Maria. So I will be talking about the wireframe. So the wireframe is a commonly used tool to show the content and functionality of a website. It's like a skeleton, it's like a blueprint of a building. This usually comes early in the development of an intervention, and this establishes the basic structure of a page before visual design and content is added. The aim of a wireframe is to provide a visual understanding of a page early in the project to get stakeholders and project team approval before the creative phase gets underway. This is the Telehealth wireframe. I will show you now a demonstration of the wireframe for our intervention Telehealth training module. This is the Telehealth wireframe. What you see here is the home page of the Telehealth training. In this section, we present brief information placed in bright colors to attract the user's attention and motivate them to look into the details of the training. This is the introductory video, and this is the welcoming message. These over here are the 4 training modules. This is the discussion board. The other element we want our users to pay attention to is that we have a mobile application. The user can go to other pages of the Telehealth through the bar on the top. So a user can sign up here if he or she doesn't have an account, or sign in to come back to the training. There's an option to sign up or sign in using the social media. Now, if the user wants to learn about the modules, clicking on Learn More will direct the user to this page. The structure of this page is similar throughout the modules. Here's the navigation bar, the video, description, and objectives. Let's go over the modules to have an idea of the layout. This is module 1, and this is module 4. We suggest these features be available in all of the module videos. This is the resource section, which links the user to external resources on network website. All of these resources are related to the topic of the video. The glossary, if the user doesn't know a word in the video, he or she can look it up in the glossary section. The script, if the user wants to review the video content, he or she can do so by looking at the script. Menu, in the full screen mode, the user can easily navigate through other capsules without going back to the module homepage. After completing each module, the user can take a quiz by clicking here. This is the quiz page. As I showed you on the home page, Telehealth has a discussion board that you can reach at any point of the training. This is the Telehealth discussion board. Here, physicians can talk with their peers and discuss best practices or questions related to telehealth. If the user wants to inquire about support from network, he or she can click here. And this ends the demonstration. So as you saw, this was an example of our proposed wireframe for the intervention. Now I'll be talking about the utility intervention monitoring and evaluation. It's very important to do a monitoring and evaluation of utility after executing the web page with the complete modules, capsules, and quizzes. By using an online platform, the built-in data capturing from number of clicks and viewers can be recorded to evaluate the traction of the website. The online training modules also have assessments to help evaluate the knowledge gained through watching the online module. Now I'll pass it to Kalpita.
Excuse me. A complementary component of the intervention is an in-person training. The proposed in-person intervention can be attended by individual providers or adopted by an entire organization. These personalized trainings provide on-demand and are tailor-based based on the organization needs and culture. We'll provide a brief outline of what the training should look like. These 30-minute in-person trainings will be done in 4 to 6 sessions. These 4 to 6 sessions can take place over the course of a few days or over the course of a few weeks based on what the organization needs. They will be split into 2 different portions, the provider training as well as different administrator trainings. This brief overview of topics that should be, these are a brief overview of topics that should be covered within the in-person trainings based on if you're providing administrator training versus a physician training. By administrator, we mean the people in the organization responsible for supporting the implementation of telehealth. So provider training, you should be focusing on what is telehealth and why you should be using it. These topics include increasing provider telehealth knowledge, training with different patient scenarios, and working with bedside e-manners. This also is all encapsulated within technology training so that physicians are well aware of how to use the technology before they start interacting with patients. They should also be able to have time to discuss with their peers about best practices and scheduling. For administrators, these in-person trainings should focus on developing resources and support. These topics include reimbursement and scheduling, as well as facilitating physician training. These 3 will help physicians get the trainings they need in a costly and time-efficient manner. It should also include how to get technology to providers and patients so that everyone is proficient in the technology use. The training should also include HIPAA and how to follow those guidelines. For in-person trainings, here are things to keep in mind when trying to implement telehealth practices. For physicians, these are based on a few key informant interviews we did. Physicians from other hospitals informed us that it's very important to find a champion within the hospital to talk about telehealth with other physicians. It's also important to get nurses on board as they spend a considerable amount of time with the patients. It's also very important to introduce some sort of best practice manual so physicians can refer back to this at any time, and facilitate a flexible schedule practice as well as peer-to-peer conversation. For administrators, best practices will include building a timeline and a budget so that physicians and administrators, people within the hospital or organization, are aware of exactly what's happening at what time, and that's the best way to disseminate technology as well. Because in order to onboard physicians and patients, it'll be important to have a timeline and a budget. I will now leave you with Alaa to describe the implementation technique.
Yeah, hi again. We've just shared our proposed intervention. Now it's important to consider how this intervention can reach the intended population. This is where an implementation strategy comes into to support the intervention. The implementation strategy we are proposing consists of 3 main elements. The first is the wireframe that we demonstrated earlier in this webinar presentation. The second is a mobile application, which we will show you in just a moment. And the third is the infographic. These elements serve as additional venues for sharing information about the intervention. They also help to ensure the intervention's longevity and sustainability. So the mobile app, which is an often overlooked component, is key to successful implementation of the intervention. The app puts the technology into the hands of a physician. This aids our goal of convenience by allowing the physician to take the modules wherever he or she may go. Since the modules can be viewed in any order, the physician can watch 1 or 2 videos whenever they have a space moment. So now I will show you a video demonstrating the mobile app.
This is the Telehealth mobile application. It's a mobile-friendly version of the Telehealth website. What you see here is the home page of the Telehealth training. This is the introductory video of the Telehealth training modules. These are 4 icons that can direct the user to different sections of the training: the modules, the blog, the quizzes, and the support. By clicking on this small icon, the user can go to his or her profile page. If the user wants to go back to the home page, they can click here. And by clicking on this small navigation icon, the user can easily navigate and personalize his or her training. Let's go to the modules. Here you can see the 4 Telehealth modules. You can scroll down to see them all. Let's go to module 4. For each module, the user can read the module information and watch any capsule. After completing each module, the user can take the quiz by clicking here. This is the quiz page. Throughout the app, you can reach the discussion blog at any point by clicking here. This is the Telehealth discussion blog. Here, physicians can talk with their peers and discuss any best practices or questions related to telehealth. And this ends the demonstration.
I'll pass it now to Deana. Our final element in the implementation of the Telehealth program is an infographic. On the next slide, I will go into further detail regarding our infographic with zoomed-in clips. But before I get into that, I wanted to just quickly go over what an infographic's purpose is for those who may be unfamiliar with it. On the most basic level, infographics are a poster-style depiction of information using both graphics and quick facts to help get your message across. The purpose of the elongated poster is to help facilitate a story that is visually stimulating rather than squished and chopped up. In this slide, we have broken the image up into sections for you to easily view the content. As you can see, the information is presented with images and quick facts to allow the message we are trying to make easy to digest for the viewer. The goal of our infographic is to promote the importance of telehealth by telling the story of its needs, benefits, opportunities for expansion. We begin our story by first addressing the populations affected by chronic diseases and low access to providers. We then explain some of the barriers individuals face to accessing care. For example, some barriers include transportation, geographic location, finances, lack of quality of care, and limited care. We then explain to show the benefits of telehealth and ease the viewer into understanding it as a possible solution to the previously mentioned barriers and provide facts that show the opportunity for the intervention. This includes such examples as the number of individuals in America currently using telemedicine and the percent of individuals willing to adopt the technology. The final component in our presentation is communication strategy. Be presenting our proposed strategies, as each one of us has taken a different approach to communicating the Telehealth intervention to possible stakeholders. But we wanted to make sure that we discuss this topic as an important component of an intervention's life cycle. The goal of a communication strategy is to raise awareness or pique the interest of an audience. For example, this audience could be providers, patients, stakeholders, possible vendors, community partners, or similar organizations. Pretty much anyone who may have some stake in the intervention. These strategies may be executed in the form of a press release, editorial, pitch letter, or commentary. You want to strategically think about who you are targeting and the benefit of their buy-in, as well as whether or not the selected communication strategy will get the message across to your specific audience. That completes our presentation for today. We want to thank you all for joining us on today's webinar. We want to also especially thank our professor, DScD, and our client, Andrew Solomon, and all those who supported us with key informative interviews and feedback as we developed our proposed intervention. With that, we're open to questions and feedbacks that you may have on our proposal. Thank you. Thank you.
Thank you.
Thank you so much, guys. So the first question that we got in at the beginning of the webinar, when we were talking about sort of the state of need, It was asked, when you say chronic health conditions are more prevalent among rural patients, do you mean chronic medical conditions, chronic behavioral health conditions, or both? And did you guys look into that when you were looking at your literature review, and any results from that?
Yeah, in the review, we checked the chronic conditions as diabetes and obesity. So that was prevalent among rural individuals compared to urban individuals.
And then we got another question that came in. What does the T and Tele-T, the name of your proposed intervention, mean?
We're using it for telehealth trainings. We thought it was a little bit catchier than that whole mouthful of telehealth training.
Yeah, very good. So I guess I have a question. As public health students, new to telehealth, and we work with a variety of folks throughout the region and nationally, stakeholders that work with the telehealth resource centers include folks that have been involved in telehealth for 20+ years, and some folks just getting involved. I'd be curious, just having the opportunity to really dig into the literature and the telehealth space, what are some of the things that you saw that may be really interesting for the future of telehealth, or where did you see maybe some gaps or some issues that you thought, well, you know, how can we improve this?
Well, personally for me in global health, I've seen a lot of telehealth used globally, but this subject matter on a national basis was the first time I've been introduced to it, which kind of shocked me as I can now see the real need in rural communities within the US. So I think just understanding now the amount of advertisement and marketing that's probably going to be needed to really uptick telehealth was really interesting to me.
Anything else? Anyone else?
Well, actually, yeah, with telehealth, like after taking this class and working in this project, I started to see telehealth everywhere around me. And because I've been working on a telehealth project, but in a very limited maybe view. So I had the projects working, doing a mobile apps, and then with taking this class and working with this project, this broadened my view and to see the full pictures of telehealth. And whenever I go to the events and I have many conversations with people and networking, some people came from rural areas actually and discussed with me the needs of this telehealth services. So there's for real like the need out there, and it's really interesting like to have this class and to appreciate that.
Yeah, I think another area where there's going to need to be a lot of growth is in the reimbursement and state licensure. And so that's an area that really surprised us in what is and what isn't covered, and definitely something that we see a big hole for advocacy and for getting people on board to help push policymakers to make that change.
Great. Yeah, we've definitely seen a lot of movement in the policy space, but there's certainly more opportunities. David asked, did you identify a product solution that would fit your app needs? So have you dug into any the actual technology, how to build the app, or not quite yet?
Actually the software we used, it's open to anyone. So there are like tons of softwares that will help you do the wireframe, and it doesn't need that expertise to do that. It's very simple. So the one I used is Balsamic, and it was really helpful to put all those elements together. So the idea of like wireframe, you can have a simple thing as a paper prototype, just to show the idea, for example, to the stakeholders. So having this software make it like more easier to do a quick wireframe to show the idea of your intervention to the stakeholders. And it's also useful for the usability testing. So even before like developing this website, you can actually test the structure you have, the wireframe, with the users, with the providers, and see their opinion and feedback, and like iterate and change the wireframe according to their feedback.
And what was it? I think you mentioned the name of it. What was that called?
Balsamic.
Okay.
Yeah, BALSMIC.
We have gotten some feedback that it's still kind of hard to hear you guys. And I think it's the issue with using the camera, because for attendees, we had a little trouble getting the audio to connect through their videos and also pick up the speaker's audio. So we had to get a little creative, which I think has affected the speaker audio a little bit. So we had another question. Are you working with the Veterans Administration as they are leaders in implementing telemedicine in rural areas? And that's certainly true. The VA is doing a lot of great things. And I'm curious, maybe to rephrase the question a little bit, in your research, did you come across anything of what the VA was doing? Did that pop up on your radar?
I did see one statistic regarding the in-home care of veterans versus using a Veterans Home Association and the dramatic decrease in costs that the VA received from that. It was, I believe, $1,600 compared to $13,000 plus.
Yeah, and they certainly are leaders in the country for telehealth and doing a lot of great things. And just, I don't know if you guys noticed this, I sent out a poll to all the attendees. Does your organization have a training program in place for telehealth providers? And so far we've gotten 20 responses back. 3 people said yes and 17 said no. So I think that, and now 4 people said yes. So it seems like there's a need for that. So I think we're excited. So for attendees, just so they know, this is something we're kind of looking at. Could the TRCs do something like this? Or maybe even better, could we help you in your own organization kind of leverage the structure that the students have proposed to implement your own internal training? And so if you're interested in any of the tools or the structure that the students have developed, we're more than happy to share that with you to hopefully help you get some more providers interested and excited about telehealth.
And we listed our contact at the end of the slideshow for anyone who has any further questions.
Yeah, I'd like to add, so I'm really interested in fashion since I'm a dentist and I'm interested to work in a teledentistry project, research project. So if anyone in the attendees has an opportunity or something, my contact is listed in the slide. Alaa. Thank you.
And before we close, we did get one more question from John. And I think this might be a good opportunity to add a little bit more about the background of as you developed this. He asked, are you hearing a lot of clinical resistance? Is this due to aging clinicians or changing from the normal protocols? So I wonder, I know you dug into this a little bit, but you did do a series of interviews with stakeholders, specifically throughout the Northeast. But I wonder if you want to share any more about what some of those stakeholders shared with you as you did some research and developed this.
Well, yeah, we had some interviews with very insightful interviews with the stakeholders. And well, first, thank you for that. And they shared a lot of their knowledge. One of the things that one of the key holders talked to me was the need of having a best practice manual, because where she worked, they have one, but she has looked at in the other institution, they have different manuals. So it would be very good to have a general manual to how to use telehealth services, especially about the bedside e-manners, that they are very important.
Also, one physician I spoke with actually informed me that he'd be willing to adopt telemedicine if it was incorporated into his schedule, not as a separate add-on. So focusing on maybe advertising it as incorporating it into your schedule from 9 to 5 rather than another additional hour to reach out to additional patients.
Yeah, and also some of the people I spoke with, they focused on the simplicity of the intervention. It's very important to make it like simple and personalized to the users. Here it comes the wireframe. When we designed the wireframe, we took all those insights into consideration and we designed the web page according to what we have, with the findings we have.
Yeah, a wireframe, very simple, very direct, where we can short the knowledge curve of the learning curve, because we know that physicians doesn't have a lot of time, so we did it very, very short and direct. That's what the idea.
So when coming up with this proposed intervention, we also thought about what we would want out of an intervention. If someone was proposing an intervention to us, we would want it to be cost effective, to be done in a timely manner, so we're not spending a few hours on something that we can easily access, whether it be on a commute on a train, or if we're walking somewhere very quickly, or during a quick 15-minute break. So keeping cost in mind, keeping physicians' time in mind, as well as keeping the simplicity of it in mind. So they can easily travel back and forth between different trainings without getting lost in them. So those were things that we found a lot of physicians also brought up during the interviews. And that was something that is pretty across the board in what you want out of some sort of training module.
Perfect. We did get one response Patricia mentioned for teledentistry. She said that teledentistry will be included in the American Dental Association's Code on Dental Procedures for the first time in 2018. And she said teledentistry leads to patient outcomes similar to in-person dentist visits, and it can also increase access to care and boost practice revenue without adding more chairs. And she believes that teledentistry is gaining momentum among many states. So certainly another great application.
Great. Thanks for sharing.
So if there aren't any other questions, we can go ahead and go to the next slide. So this has been part of the National Telehealth Webinar Series. We do host these on the third Thursday of every month, although this month was an exception. In May, on May 18th, the third Thursday, we will be hosting chronic care management and remote patient monitoring, improve care coordination while increasing revenue. And our speaker will be Bonnie Britton with Reconnect for Health. Bonnie is an incredible resource around chronic care management and some of the new Medicare chronic care management services like the 99490 CPT code. So if you're interested in that, definitely encourage you to sign up for that. We will send out the registration link to all attendees on this webinar through the Upper Midwest Telehealth Resource Center. And I'm sure the registration link will also be posted on the National Telehealth Resource Center website, telehealthresourcecenters.org. Next slide. So we'd certainly love any feedback you can provide. And I know the students requested the feedback too. They'd love to see the results. I just sent this link through your chat, so you have a live link if you have an opportunity to click on it. We certainly appreciate your feedback as we continue to improve this webinar series. So with that, I don't think we have any other questions. So thank you guys so much for presenting this and doing all this hard work. And we're certainly going to push it out and make it available to anybody who's interested in leveraging all the resources you've discovered.
Thank you
Thank
so
you.
much.
Thank you.